Abby, good evening to you. We've seen long lines for testing in the past few days. What's today been like?
Good evening, Anton. Well, long lines at the vaccination centres today. This outbreak has provided a massive push for the state's vaccination program. In the first 15 minutes that 40 to 49-year-olds became eligible for a dose of Pfizer, there were 77,000 calls to the hotline to try and book a dose. They've had to put on more staff for the call centre and push ahead with the rollout of an online booking system. Now, the state government says today marks 1 million doses administered in the state. Front of the line for a first dose of the Pfizer shot, the acting Victorian Premier marking the 160th day of COVID lockdown since the start of the pandemic with a personal contribution to the state's vaccine efforts.
It was painless, it was harmless, and I'm glad I've got it done.
The opposition leader not far behind, while others queued at vaccination hubs from the early hours. Over 17,000 doses administered yesterday. Similar numbers expected today for those who managed to secure a place.
It took me 5 days to get the appointment.
It took me 87 times pressing the redial to actually get through to the hotline to book.
It took a couple of times to get through because the line dropped out, but I persevered.
Melbourne City Council involving cold community groups to ensure no one who's eligible is left behind.
To really ramp up our communications and support for people, particularly in those groups that have been hesitant.
The CBD a ghost town on day one of the so-called circuit breaker. 4 new infections linked to existing clusters that now stand at 30. One believed to have contracted the virus at a bar east of Melbourne.
We could get 10 tomorrow, we could get 20 tomorrow. We absolutely have to recognise that there are thousands and thousands of close contacts still to go through their incubation period.
In a country where we've had virtually no community transmission for close to 3 months, people think that there's no COVID.
Protests against the lockdown in the city centre last night, more planned for the weekend.
If they do, they run the risk of being fined and being fined quite significantly.
The state government requesting another 160 ADF members to enforce the lockdown. Businesses stayed open until the very last minute of authorised trade, many today wasting hundreds of dollars of stock purchased for the weekend.
We've actually had to, dwell into our own savings to maintain afloat, pay the rent, pay the bills, and obviously keep the stuff that we've got on.
The Victorian government says it's in talks with federal counterparts for a support package for businesses affected by the circuit breaker, and details will be revealed in coming days. But business groups say they need answers now. With estimations, the lockdowns will cost $2.5 billion a week.
And that doesn't include the wages that will be lost as well. So off the back of that, what we're asking the government to do, the state government and the federal government, is to look to the level of support that they're going to be providing to businesses.
Testing numbers again hit new records with over 47,000 getting swabbed. The state government urging people to keep it up, with the link connecting the COVID case from Adelaide's hotel quarantine to the Melbourne cluster still yet to be discovered.
And Abby, that key factor now, how many close contacts have been detected in this cluster now?
Well, Anton, we're over 15,000 close contacts, 1,400 of those primary close contacts, but there's fears more are out there. Amongst the 121 potential exposure sites, we have a number of pubs and bars where social distancing isn't always observed, and we know at least one case in particular did contract the virus at one of these venues. Victorian health authorities also fear that people have become lax when it comes to QR code check-ins, and so they fear more patrons could have been exposed than we know about at the moment.
That's reporter Abby Dinham reporting from Melbourne on the Victorian lockdown.